yoga. Jamie has. Lauren has. Will has. Jeanette. Okay, so cool. Okay, cool. Okay. So I think a lot of people get, I'm not assuming that you do, but some people do get confused what yoga is exactly. So yoga means union. It's when we learn the history and the origin of it, it's a Hindu philosophy of a system of physical and mental practices. So it's not just, sometimes when we hear about yoga, we hear about it as like, oh, I'm just moving my body around and everything, but it's so much more than that. It's a union between the body, the mind, and the soul. And it's a connection that we're practicing. And it's a practice, it's a mindful practice. So I'm here to talk to you about ways, as Jeanette did with coping mechanisms. And one of a coping mechanism that I've been practicing and that I've been sharing with people that I care about is mindfulness. It's mindful meditation. So what are some ways in the world, in the realm of yoga, that people who are struggling with arthritis do in terms for mindfulness and for meditation? Well, some of them are MBSR, which I'll get to, which is mindful-based stress reduction. And it's used in a lot of clinics today, rehabilitation clinics, center-based, where people who are struggling with mental health illnesses, or even in people doing social work, active meditation, yogic breathing, which is pranayama breath, guided imagery meditation, which is visualization techniques using for meditation, and transcendental meditation, which puts you in a complete subconscious mind on a totally different level. And I'll get to that as well. So does anyone have any questions so far before I move on? No, we're good? Okay, good, okay. So mindfulness, it involves focusing your awareness, anything that you have going on in your mind, and just bringing it out forward into the present moment. So it means that you're paying attention to all of your sensations, is what Jeanette had said before in her acronym. All of your senses, your feelings, your thoughts, what you feel, what you smell, anything. Because there's tons of grounding methods that you can do other than breathing techniques, anything of mindfulness. So it lowers your stress and it decreases depression, improves your memory, strengthens your relationships, and among other things too. So mindfulness was identified as an effective mental health practice for helping almost all people to improve their physical and physiological well-being, as well as helping any chronic illnesses. So there's different types of meditation that you can do, as I've named, specifically to assist in treating arthritis, not to cure, not to treat arthritis as it is. I would never say that because I'm not a doctor. It can be done in quiet places, as what I'm sure some of you have done. You can use a comfortable posture, sitting down, lying down, or even walking. You can focus your attention on a word, a set of words, or an object, or a body part, or you can do breath work yourself, which is what we'll be doing at a later time in our meeting. You have an open attitude, positive thoughts about yourself, positive self-talk, because we never want to talk negative about ourselves. That would be silly, right? So, so one of the most effective forms of meditation for arthritis and mindfulness is all about focusing solely on yourself. Never want to focus on anybody else in the moment. Never want to focus on, oh, I have to feed my dog in an hour, or I have to do this project for work that's due, tomorrow, and I have to take my work home for me. It's all about non-judgmental thoughts. It's all about, who am I right now in this present moment? Like, as I'm going to refer back to what Jeanette was saying, like, this is what I have right now, and I'm only going to focus on what's going on right now. And it's a pretty simple concept. It sounds it can be harder than what it is, but I think sometimes as people with illnesses, as far as empathy is concerned, I feel as though from my experience of dealing with a lot of people who have illnesses and chronic illnesses, we are a lot more empathetic because of what we feel physically and how we feel mentally about ourselves. So we have a lot more feelings. We feel a lot more. And I know that because when I've gone through techniques with people with breath work and with meditation, it's a sense of emotion that comes out of them. And it's not sadness, it's more cleansing. Who people who have post-traumatic stress disorder, from physical illnesses, or trauma-based stress reduction. So it comes out of them in a physiological way where they're just releasing inner emotions, and it's releasing on the outside. So, um, does it work? I mean, if you're consistent. So studies have shown, in an analysis in 2017, I believe 2017, that it had decreased depression in arthritis patients, increased emotional regulation, cognitive ability, um, reduced brain fog, and reduced the chronic illness and physical pain. Like I said, it's not a cure, but it did reduce pain. So because mindfulness and meditation can help improve the mood and combat stress, it can also be helpful for people who are dealing with the illness itself. So I'm just going to give a brief discussion of the top 5 ways you can combat your illness in the best way possible. Now, going forward, if you have any questions, if you want to talk further about this, because I'm just going to breeze right through it, you can always reach out to me. You can reach out to Emily. She can give you my information. I'd be happy to talk to you about anything or any exercises you want to go through. I'd be happy to do that with you. So the first one is called MBSR. This is used in a lot of clinics around the country. I think it's about 800 clinics that are used today. It requires training. I'm certified in it. It's mindful-based stress reduction. So this is a meditation technique. It's all about being present and in the moment. It's about being mindful, and it's being in a non-judgmental way, like we had said. And this is probably one of the best techniques that I absolutely love, that I use every day for myself, other than breathing techniques. So it's a very structured program. They use auditory mindfulness, which is in a non-judgmental way, listening to the sounds around you instead of just going for a walk and putting your earbuds in and listening to music. You're listening to the dogs barking outside or the birds chirping, and then not analyzing it, but just letting everything just be as it is. There's other different mindful ways. There's this 5 sense method where you're using all of your senses around you to bring everything forward and out of your head, basically. It's a way to support resilience and healthy coping skills and good coping methods for your MBSR. It's not a cure, but it's a really plausible way to help cope with all of with whatever you have going on physically, but also psychologically, because we do know that when you have a physical illness, it can take a toll on your mental health. So active meditation is next. It goes along with your MBSR, with your mindful-based stress reduction, but this is sort of just there's different ways to be actively mindful. There's Tai Chi, there's yoga meditation, which is to be physically active. There's actually just exercise, going for a run, going for a walk. This is an auditory or a mindful movement, which is what I had said, the taste and the smell. That's also an active movement of meditation. You can make anything mindful, as long as, like I had said in the very beginning, if you are just making sure that it's a positive experience for yourself. And once again, this just takes practice for you. Now, yoga breathing, and it's called pranayama, and that is a yoga Sanskrit. So it's a core element of yoga practice. They say for meditation, if you are not connecting your mind to your breath, you are not in a present state. It refers to the conscious and controlled breathing. So if you have, say, the box breathing method, which is you breathe in for 4 beats, you hold for 4 beats, and you breathe out for 4 beats. You go so deep into your breathing method, you are completely in control. That's the whole concept, is you being in control of your own thoughts, you being in control of your own body. There are some things that we are not in control of, but if there's one thing that meditation does, is it grounds you and it puts you in control of what moments you have with yourself. And that's part of yogic breathing. Okay. So guided imagery, one of my favorites, which is what I do for a lot of my clients. It's a visualization technique. And it harnesses all the power of your thoughts, your feelings, and it improves any relaxation. And it puts you in a comfortable positions to visualize a scene. So if a guided meditation coach says, everybody lay down, take a deep breath, feel the breath within you, connect it to your mind and to your body and to your soul, hear and taste and touch and smell the grass underneath you. And it's that visualization that you're going to put through your mind. And you're going to think about the alignment between you and the ground and the earth and feel that grass in between your fingertips. And it's that visualization that you're going to have. And that's going to get all of those thoughts that you've been thinking about all day long, about the pain that you have and about the flare up that you've possibly had that day. And it's just going to push all that out. Once again, it takes practice. So me talking about it for the past 5 minutes, I know it may be like, oh, I can't do that, but you know what? You can, because the can't is irrelevant. So the last one is transcendental meditation. So this one does take, it does take training, and I think it takes a couple of years. But there's no harm in wanting to do it yourself. There really isn't. And this, in particular, from what I had researched, before I came on here, it's usually for milder and easier to control illnesses for people with arthritis. And I think it's because you are sitting for a longer period of time. I do know for people who happen to have a flare up every now and then, which is like my condition, because my condition is not as bad of arthritis, not now at least. Hopefully it stays that way. So this type of transcendental meditation is a very deep in thought process where you're saying a repetitive mantra. Has anybody ever heard of the word mantra? Oh, you have? Okay. Awesome. Okay. TM, you don't have to use a particular type of mantra. You don't have to use Om or Ram or Vam or anything like that as part of your chakras, if I'm going too fast for you. Anything as part of your chakras, but you can use I am abundant, or I am beautiful, or I am caring and I love myself. You can continue to use that same mantra over and over again. And you're sitting for at least 15 to 20 minutes at a time. And it's the focus of clearing the mind of thoughts and just gently bringing attention and awareness back to you in the present moment. I pretty much the only difference is that you're sitting for a longer period of time. You're doing it twice a day. But you can meditate as much as you'd like, really. Go for as many walks as you'd like. So, so everybody's different. We all have our different ways of feeling throughout each day. But So how do we stay consistent? I can answer that question.
Oh, I was gonna say like trying to do it repetitively or more
Okay.
than once.
Okay. Being consistent. Perfect. What would be another one? Okay, we could keep it brief. I think no, that would be one. I would say keep it brief. That would be a good way to meditate for arthritis would be to keep it brief. Possibly if you're not used to practicing it on a daily basis, start 5 to 10 minutes a day. Um, Whenever you are doing it, if you're going to do breath work, if you're going to incorporate breath work, if you're going to incorporate breath work and your mantra, if you're going to go for a walk, depending on how your body feels that day. Really, it's all going to depend. Also, adjust your focus. Um, does anybody else other than having arthritis, have a you can just raise your hand or say yes or no. I know, I other than arthritis, I have epilepsy, and I also suffer from anxiety. So I take medication for anxiety, and I also suffer from well, I'm getting tested for ADHD as well. But because of these mental illnesses and because of my neurodivergent mind, I have to change my focus a lot. So I can't sit and meditate. That's a big no for me. There is no way I could sit and for 15 to 20 minutes because my mind just goes all over the place. So I have to change where my brain goes, especially my epilepsy, because if I sit for too long, like there has to be like a shift. So if that's how your brain is, and I'm not going to get personal, you can shift yourself. You can say, okay, I'm in a little bit too much pain right now, or my brain is changing. Um, Focus on a different part of where you're located right now. If you want to go for a walk and go for a walk, you can shift your location. You can shift the way that you're thinking. You can shift the way that you're feeling. If you're going into a meditative state, and you start feeling a bit of anxiety, you might want to try a grounding method, which is what Jeanette had spoken about earlier about feeling all of your senses, and which is a grounding technique that MBSR, which is mindful based stress reduction, uses. Which is you do 5 things you can see. I think it's 4 things you can feel. I have to look that up, but I'm going to tell you. I'm going to tell you it's wrong. Probably. Yeah, I'm going to do. Jamie's got the thumbs up for me. It's 5 things you can see, 4 things you can hear, 3 things you can taste. It's the 3, 2, 1, 5 grounding method, but I'm not going to go any deeper than that. But anyway, but yeah, but then also just do what feels right. Um, there's so many different forms of meditation that I've put into 10 minutes. Um, and so many different mindful based practices that including yoga, breath work, walking, active, mindful eating too. I mean, mindful eating is awesome because I love to eat, but you can you take a piece of food and you just instead of just eating it like you just embrace what you're eating, the texture, the feeling of it, how it just like then you swallow it and then it makes you more grateful, not only for what you're eating, but what your mind is thinking at that very moment. That's just what it is all about mindfulness. So deep breathing exercises and chanting too. I mean, I know I'm throwing so much, but that's the gist of mindfulness and meditation is just not thinking about anything else. So just think about what you got going on right in front of you. So does anybody have any questions for me about meditation, mindfulness? I was that good? Okay. Awesome. Okay. All right. So we're gonna do we're gonna do the nani shodna. That's an alternate nostril breathing technique. All right. Fingers are going to be a little difficult. But if you want, I can send Emily the email of the link of the Nani Shodhana. Basically, you have your cooling side and your heating side. If you ever notice going forward, what side you sleep on and what side cools you down. Okay. When I sleep on my right side, I feel less stressed, which means that my left side is my cooler side. Your right side is your more heated side. So, yes. So in your Nani Shona breathing, you're going to want to put you can sit comfortably, and you're going to want to take your thumb and close your right nostril. Okay. And you're going to want to put your left hand and rest it. So this is only, I know we're all sitting in chairs. So you can put your hand down right now. I know we're all sitting in chairs, but the next time that you do this, your back would want to be erect and straight, and you would want to be grounded, possibly sitting on a pillow, because you would never want your root chakra to be touching the ground. You'd want to be slightly elevated because you'd want everything to be sitting up straight. I know it would be like, oh, we want to sit Indian style and have our root chakra touching the ground, but in old Vedic meditation, you would want to be sitting on a meditation pillow. But it could be anything. It could be like one of these pillows that I'm touching right now. That's fine. That works. So the fingers for your nostril breathing is thumb is going to be on your right nose. All right. You're going to put your finger, right. And then your other fingers are going to be here. But to make it simple for you guys today, we're just going to go like this. So just take these fingers here, and we're just going to put that on the left nostril and the right nostril. And just alternate that for just real quick. Perfect. Okay. So just take a couple deep breaths in, close your eyes. Couple deep breaths in. In through your nose, out through your mouth. In through your nose, out through your mouth. And just roll your neck a couple times. Good job. Just roll your shoulders back too. So now that we've gotten those fingers out of the way, you're just going to breathe in for 4 on your left nostril first. And then you're going to breathe out. You're going to hold. And then you're going to breathe out on the other side. Now, as you're holding the left nostril, you're going to breathe in at the same nostril you just breathed out on, which is your right nostril. And then hold both nostrils in. And then breathe out on the left nostril. Nice deep breath out. Same nostril you have. Breathe in on your left. Close both nostrils. And open the right one out. Breathe in on your right. Close both nostrils. And breathe out on your left.
Let it all out. Breathe in on your left. Close both nostrils. And breathe out on your right. One more time. Breathe in on your right. Close both nostrils. And breathe out on your left. All right. Just let everything down. So there's other breathing techniques you can use, but this one is the most common that you use for people with who have difficulty letting out that breath during the day, who have a hard time breathing in. It eases a lot of anxiety, calms your nervous system. It gets a good deep diaphragmatic breath in. If you do, which I forgot to ask, I'm sorry, if you do have a heart condition or any pulmonary diseases or have asthma, I would suggest reaching out to your doctor if you do decide to do any pranayamic breath. Because any people with neurological disorders, since it's such a deep breath in, you could tend to get dizzy or lightheaded. But if you're okay, you can continue to practice. And plus it can, make you feel more at rest. And it's a good thing to do before bed too. So, does anyone have any questions? Comments?
I noticed that my left nostril is more like takes in more air. Like the inhale is stronger.
The inhale is stronger. Yeah. Um, it, I believe that could mean that that your left brain and your right brain is like one side is your cooling side and then one side is your more heated side. Like if they have like your yin and your yang, right? So if one side is your cooling side and one side is your more heated side, then I believe that may mean that that side is your left side is more active if it's stuffy. Or it could also mean that you may need a lymphatic drainage. I'm not sure. So if you do a lymphatic drainage here, it could mean that you may need some. So I don't know. It could be that. I'm like I said, like I'm not a doctor, so I don't know if it's stuffy or not, but it could be that. I always just jump on the trampoline or something and just try to get that drainage out. But yeah, sometimes if you're doing that can definitely, do that to you. So yeah.
I was surprised by how calming it was. Like, even just focusing on the breaths, like, again, it took my mind to like one specific spot. And I don't know, I feel a lot more relaxed now.
Yeah, it does. It does. It does that. That's one of my favorites. I'm glad that you enjoyed that breathing technique. Um, I found that breathing technique through one of my yoga teachers. She was doing it at her class once, other than the Ujjayi breath, which is a very ocean, it's like an ocean-like breath that you're doing, and you're really letting out all that carbon dioxide that you're breathing. And yeah, it's a very powerful breath, and it's really good for people like us that are struggling to breathe, because very seldom are we aware that we were even breathing, because we're just taking these just subconscious breaths all the time. We're like, just gonna breathe, and we slouching our backs, our posture's bad if we're sitting at a desk, and then like if we just take a stop and just do some breathing exercises throughout the day, we'll get all that toxic air out, and then do these breathing exercises, and we'll all that toxic energy, we'll get that all out just by breathing the right way. You know. Yeah, I'm glad that you guys were a little more relaxed. I hope you all were a little more relaxed with this. You'll sleep like babies tonight, hopefully.
It seems like it would be really helpful, especially that one particularly, because it's a lot. I found with that one, it's a lot harder for your brain to kind of wander because there is that movement piece. But I think breath work is so important for chronic pain because I hear from a lot of people, especially when they're in pain, their breath holding, like they're not breathing properly.
Oh yeah.
Yeah, I spoke about my grandmother before, and she used to almost like brace herself to go upstairs because it was painful, and they couldn't figure out why she would go upstairs and then pass out. They're like, is it something? They did testing, all this, and the physical therapist realized that she's holding her breath and not realizing it.
Yeah, yeah, I know. I just like I look at my mother and I see she used to be a hairstylist for so many years and she wasn't properly diagnosed with rheumatoid arthritis until she was like 60. Because back then they didn't have the technology that they have now, you know. So at 60, they're like, oh, well, you have an autoimmune disorder. Congratulations. I was like, oh, okay, that's wonderful. And her being a hairstylist and standing up and like, and you're absolutely right. Like, and the issues that she has with her breathing was bad enough dealing with all those chemicals all those years and coughing so much and like the fact that I see her struggling to walk, I see her physically holding her breath. And you're right. Like I see that breath just hold when she's getting up and she's like, oh, like, like I feel that tension. And if you just let go of that tension, your muscles will relax, your joints will relax, the fluid will flow, that connective tissue, the joints, the fascia, everything will just relax and flow. And that's where like some yoga exercises come into play too with your arthritis. I mean, that's a whole different thing than, I can't get into now, but I mean, it's all about the breath. You're right.
Yeah. And I like how you brought in exercise too. That was a good reminder, because that's such a great coping tool too, and a good place to focus on some mindfulness and really being present where you are, but also just even on days where, there might be a lot of pain or other symptoms, even just like gentle movement can help to loosen all those muscles because sometimes we're just really clenched when we're in a lot of pain and stress and stuff, and we don't realize it. So even just like gentle movement can be a great stretching, things like that.
You're right. And I think a lot of it has to do with trauma because I think, even as kids, like when somebody tells you, oh, it's all in your head or it's mental. And then you're like, oh, okay, well, it is all in my head. It is just mental. And then you tense up and you're like, no, I don't really feel this way. I really don't. I'm not supposed to feel this way. And then, then you get diagnosed or you get misdiagnosed and everything and the pain that you feel and that tenseness. And then you feel like, oh, what can I do? I mean, and it's a perfect example of what you were talking about before and not hurting yourself in the process. Because if you're talking down to yourself and you're saying, I am the problem, I'm thinking too much, when you're not thinking too much about it. If you talk down about it and if you dismiss your own feelings, that's what it is. If you dismiss your own feelings and you say my feelings are not valid, then I'm not going to get better. So that
Yeah.
was
so many people that I work with, one of the biggest issues is that they don't even know what they're feeling. They don't even really know what a feeling is. They'll say, I feel, and then all of their thoughts. But those aren't feelings. Feelings are those one word, happy, sad, lonely, disappointed, confused, and until you can be aware of what you actually are feeling and all the feelings, it's hard to treat that emotional pain.
How do you deal with that? How do you try to bring that out to somebody though? How do you ask them, like, if somebody says like, okay, well, I think I'm going through this or something, you ask them like, how do you feel? How long does it take for someone like that to process that? Do you give them all the time that they need, but at the same time, it's a process for them.
Absolutely. It's a process. And some it takes way longer than others. Some it's just you have to bring it to as just their attention. Like, oh, well, what you're really telling me now is your thoughts about the situation. But what are you feeling? And you can reflect back and use your own empathy, because you can typically feel what someone's feeling. You can get a sense that, oh, wow, that person is happy or excited, or, oh my gosh, seems really sad. And you can reflect it back, and that's helpful too. And, some people it takes, especially because I don't know if anyone has ever noticed, you'll notice more now, but a lot of people do, instead of saying, I think such and such, they use the words, I feel such and such and such and such, like it's hard if it's a couples therapy and you're trying to help them do the I feel statements, and they're like, I feel that you don't pay attention to me, or I feel that you never help. And that's your perception, right? That's your thoughts. But what we're asking you is to say, how do those thoughts and perceptions impact how you feel? So I feel perhaps lonely or neglected or unsupported or unhelped or invalid, or, what are the actual feelings, so that those can be tended to. That pain needs some tending to. Also, it triggers empathy in most people. If you tell them, listen, I'm feeling really sad, or I'm feeling really disappointed, or whatever it might be, due to X, Y, and Z, rather than coming at them with all of your thoughts and ideas about their behavior.
Right. No, that makes
It's
good
also,
sense.
yeah, and it gives us too a little bit of a sense of ownership, because the real truth of it is a person can behave the same way to two people, and two people have a very different perception of that person's behavior and very different feelings about it, because our feelings come from our perception about the behavior and a long held belief system. Somebody could have a belief system from their trauma or their past or different things that are occurred in their life, that people are untrustworthy and unsafe. But another person doesn't think that, and therefore this one thing that triggers one person, that person that feels this mistrust and perceives mistrust is not going to trigger another person that sees people as safe and honorable and trustworthy, because they have a different worldview and a different belief system. Because we didn't talk about, but there's something called core beliefs. Those come from, they can even come from just some benign thing that happened in childhood. It's how you then came to view and perceive the world around you. And when that gets activated, that's where your thoughts, the negative automatic thought distortions, come into play. And then they impact those feelings and behaviors. I'm trying to think of a good example. Say somebody was, kind of ostracized a lot as a child. They may become to believe, it may be their perception that there must be something wrong with them. So their belief is that there's something wrong with them. In order to be safe, I need to please people. And so their behavior becomes one about pleasing others, and they're easily triggered if someone seems unhappy. So the checkout girl is kind of rude. So their thought distortion is to personalize, oh my gosh, there must be something about me. And then they feel really unsafe. And then they want to do something to help bring about that person feeling better or happier with them or something. It's a response to those core beliefs due to something that happened a long time ago.
Mhm.
But we carry it with us.
Well, yeah, I mean, like, I know as a child with my disability, um, it took me a long time to realize that that was my core belief, was the
Yeah,
that, yeah, was, I mean, I thought it was other things, but up until adulthood, it took me a while to find that, oh, well, the diagnosis and everything. Yeah, that was tough to come to that realization that the epilepsy was ultimately, and then the physical pain, and then getting diagnosed with other mental illnesses. I was like, that was what was my core belief, was the fact that I had such resentment over the wrong things, that the hatred that I built up inside me, and the distrust and the misunderstanding as to why I had what I had, and it was just the trust, the lack of trust, and the codependency I had to have, I was forced to have on other people.
sure.
Yeah,
Yeah.
yeah.
Because we don't have skills in childhood, so we interpret things very differently. I know someone has spoken about, um, they equated their chronic pain with them having done something.
Mm.
Because in their mind, it was very, at that age, it's very black and white, very linear, right? So this thing happened this day, and that's now why I have chronic pain. And so she's always, to this day, in this cycle of needing to control and everything to sort of be perfect in order for her to feel safe.
Mm.
But it's amazing how it can be these smaller things, because we're children and our beliefs are formed in this childlike mind. It's that inner child that we all hear about. And
It's-
it's not until adulthood, if we have the help, that we can, break through some of these old beliefs and talk back to them and challenge them a little bit.
It's so amazing that you said that, because you said that, the patient had said, like, black and white, it is what it is, and there's no looking at it. But as a when I when I look at that, it's that, like, there are gray areas. There
Hmm.
are there are gray areas, because when I work with neurodivergent people who have autism and ADHD and Tourette syndrome and epilepsy, people with autoimmune diseases, like, part of that definition of neurodiversity is because we are diverse. And people who have a neurodiverse mind can develop neurodivergent minds later on in life. That's what severe depression is. And that's why when we look at people who have chronic physical illnesses can develop these neurodiverse minds, can develop depression, can develop PTSD, can develop you know, anxiety. And that's why there are gray areas to that. And that's why when this non-medical term developed in the 90s by an Australian sociologist, I don't have her name, but I'm sorry for that. But it really, like you had said, like, it challenged a lot of people who are now not neurotypical people. There's so many things that are growing out there, and science is getting better with their, with being, more in tune with other people's diseases and disorders. And now it's not just, oh, all you have is just arthritis and that's it. You can only have one disease and that's it. You
Mhm.
can have multiple diseases and that's fine, so.
Yeah. Yeah.
Mhm. I had one more thing. I forgot what it was. Does anyone have any questions for me, at least, while I'm here?
I have a question. How do your clients with like Tourette's and autism, I'm not sure like what end of the spectrum the individuals are, but how do like, I guess more on the severe end of autism spectrum, like how do they respond to yoga, and like how do you kind of modify that for them,
Um,
or modify it?
oh, no, that's fine. Well, um, just like what we were talking about as far as mindfulness is, there are ways to adjust your own way of doing mindfulness, and meditation. Just like with mindfulness, based stress reduction is there's so many different ways. Like I had said, there's auditory mindfulness, and a lot of neurological disorders have sensory issues. Um, certain autism spectrum disorder has there's different spectrums for autism, where it's just a social disorder. It's it could be as simple as that. I mean, it's so complex, but, or they could be just, could be perfectly cognitive and aware, but just have those sensory issues, they could just, be sensitive, very, complex, sensitive, where they can sit and meditate and it would be easy. Some are nonverbal. But I'd say the people who have autism that are completely nonverbal and unable to really communicate their feelings and their emotions, who have autism, um, breath work is usually the way to go in that aspect. It's the breath work because they're very tense and, um, it's very hard to communicate. And that would be an initial thing that I would do with them. Because, that would be the best stress reduction technique I would do with children or adults who are unable to express how they feel. You can't really do, a guided meditation with someone who is unable to, um, verbally express.
Like interpret those feelings and
Yeah.
like what the image brings to them.
Right, right, right. Best thing to do is some sort of pranayama breath work technique. And it's fun for them because, it's the best way for them to know how they're doing it. If they're doing a kind of breath work, they see it's actions. It's what you're seeing, facial expressions. That's fun for them. Someone with Tourette syndrome, I haven't really done much with people with Tourette's. Um, uh, I used to be a music teacher. So the most I've done with them was just music, really, and sound healing. I haven't done meditation with them. So,
Ironically, my son, he's 9, he has Tourette's and
oh,
ADHD.
oh,
And he's been doing, it's called CBIT. It's therapy regarding Tourette's. And it's amazing because there's some breath work involved, not at the level of which, like, she's not knowledgeable to the level which you are as far as it, but it's interesting because it's a lot about first being aware. What does the body feel like before the tick? Before you tick, what does your body feel like before that urge? And be mindful of that. The next piece is a competing response. And oftentimes it either comes to breath or something else and breath, like breathing through it. Almost like in Lamaze, like when it's like breathing through your contractions. It's like breathing through this sensation when and noticing. So it was really interesting when you were going through it. I was like, oh wow, this is and then you said you worked with some people that had Tourette's.
mhm. Oh, that's what it was. Somatic healing. I believe what you had just mentioned, with that is a type of therapy that you could introduce as well. It's body centered therapy. Is that
Mhm.
it? Can you said it was your daughter that has Tourette's, your son, your son.
My son,
Okay, so has that ever been introduced?
I'm going to talk to them about. I know just from studies what you're talking about, but I should talk to them about that and see. Um, it was really hard to find this. It's through Rutgers. They have a Tourette's, uh, like it's like a research and um, it's part of the clinical psychology program. So the um, uh, it's all students. Like they haven't
Oh,
graduated
is it
from
like
their
a
doctoral.
clinic? Like a
Yeah,
research clinic kind of?
yeah. And this is specifically called CBIT, but it's like an incorporation of what you're talking about. And I wonder if they have been researching that or studying in that. I remember it being brought up he goes to, it's called Camp Fantastic. It's a family camp for Tourette's, kids with Tourette's. And that was discussed there briefly, but it's interesting.
Body-centered therapy.
Yeah.
Yeah. It's really the yin that I teach is considered somatic healing. Well, I mean, I consider yin, well, yeah, they do. Consider it, yin yoga is considered somatic healing. But yeah, it's supposed to heal psychiatric and physical ailments at once, just releasing and letting go. And it's considered a connection of breath work and body healing. So it just made me think of that because, not only is he having his tics, but he's also incorporating breath work as well. So it just
Yeah.
made me
Yeah.
that.
As part of that competing response. And it's good because typically Tourette's, it's a spectrum. So there may be auditory processing thing going on, there may be OCD, anxiety, ADHD, and autism is often, there's a kind of like an intermingling there. But even just that first piece of actually noticing, which we've talked about so much tonight, noticing what you're experiencing as far as thoughts, feelings, body, is like one of the biggest first steps before you can even do anything else.
Yeah, I love that. It's just it's all about our connection and being self-aware of who you are and not letting your illness be you, as you had said in part of your discussion, because it's not who you are. Like you had said, it's not who you are.
Yeah.
Mhm.
Well, thank you, everyone. Very informative discussion, very thoughtful, intentional.